we're going to do the case called Mandibular Overdenture as scan appliance. So we're going to kind of build off of what we just talked about here. So we're going to I'm going to go into Blue Sky Plan. I'm going to show you how I set up a case here. Now, each time you start a case, we've got to have your STL files and your cone beam. So in this case, our STL file is the lower denture that we scanned. So what I did was I took a patient's existing lower denture, I relined it with just some impression material, so some heavy body, just because you want it to be a good intimate fit against the tissue. Because if you scan a sloppy denture and you make it into a guide, it's going to be a sloppy guide. So it's only as good as fit as the denture is. So if it's not well fit, you want to reline it. And then I put composite around the denture to mark it. And so they'll show you that in a second. So I start and I click surgical guides. Almost every case I'll start by entering the surgical guide module. And then I'll always start with the CT scan first. So just ignore any updates. These towers are probably not the most updated. Blue Sky will put out an update every month. So I'm going to open the CT scan. And I'm going to go into my case and I'm going to find my CBCT. And then it's going to say, is this the one that you want to open? You don't need to mess with anything. I always just hit yes. And the very first thing it's going to ask you is, do you want to crop your DICOM? Now, you can crop it or rotate it. I'm not going to do that, but I certainly could sit here and crop this down and take off some of this top portion. Just, the value is it's less, image that clogs up your screen, and it shrinks your file size down a little bit. So it's optional. You don't have to crop it, but you certainly can crop your 3D box, your volume, to reduce file size. So this is what the software looks like when it comes in. And the next thing it's going to ask me is, do I want to import an additional surface? And I'm going to say yes. I'm going to import an STL model. Because I have this file as an STL, that is what I choose. But let's just say you scanned an impression in your cone beam. Well, that would be import CT of impression. Let's say you're importing a CT scan of an impression with markers. This would be that. These are all CT scanned files, which I'm scanning an actual STL of a denture. So I'm importing the STL. And then I'm going to come in here and find my lower denture. So over here on the right, it'll give you a preview. So you can get a preview of what this is. So this was a patient's worn down lower denture. She wore through all the teeth. I put some heavy body PVS just to get that reline going under here. And then you can see these little buttons. These are just composite that I put 2 on the lingual, 2 on the lingual. I put 2 on the buccal. I just kind of made these little balls of composite here. So I'm going to show you how I line these up. So let me show you, tell me if this helps here. I'm going to show you how I do this. Now watch it. It's going to try to do an auto align. And I'll tell you, if you do composite buttons, it's not going to get this right. If you do the glass beads, which are like a stick-on glass bead, they're like $1 a piece. You got to buy 100 of them. You can certainly do that. Those are apparently more accurate. But you can see right off the bat, it's going to say check your alignment. It's way off. So you can see over here, right? We're nowhere close. So how do we get this thing aligned? I'll tell you how I do it. See this slider? This is your density of your cone beam. So this is how we look at control the density. What you want to do is I'm going to take this thing all the way to the right. So what do I get here? I get my 8 little composite beads here. Now, under our model manipulation, this is where we have our different abilities to align things. So I'm going to click the CT points. And what it's going to do, it's going to create a surface model of the CT of these 8 points here. And then I'm going to show you how you want to orientate them in the same view and then click your points, and you'll be pretty accurate here. So I'll show you. And what I found here is helpful is if you want to look at this in the same view, if you can get the whole thing in the same view, it's helpful. So I'm going to look at this thing top down, and I can see 1, 2, 3, 4, 5, 6, 7, 8. And I can see 8. Now, this resolution is terrible. I'm having a hard time seeing on this big screen, but on your guys' smaller screens, it's going to be easier. But essentially, I'm going to go through, and I'm just going to click, shift-click my various points from the same view. So if you just go through here, and you're just clicking. But I'm looking at this from the same view, and I know what's what here. I found that this was a little bit easier to look at it from one view rather than like trying to roll around and like hit it all. So this is...
After this section, let's make sure everyone's in the same area.
Okay.
We're lagging behind a little bit.
So I was saying that I was going to go through a fast one and then redo it and like kind of walk it through. So
That makes sense.
does that make sense? Okay. And then if I hit OK, now it's going to realign and it's going to move this thing back into position. So now you can see this thing lined up. And you see how you get a little bit of that overlap right there? So that's what you want to see, is those little balls just kind of overlapping right there. So now if I pull this back out, now I'm lined up. Okay? So now we've just aligned that patient's denture with their cone beam. So now we want to go and place some implants. Little bit of housekeeping here. I always like this button right here is called switch between slice and composite. In your panoramic view, I always click this because I kind of like this view better. It always defaults to this. I like this. What the difference is if you look at this axial view, see how there's just a yellow line? This is just one slice all the way through the yellow line, where this is a composite of like various thicknesses. So this is like, think about like the thickness of the trough of which it's being viewed. So that just gives me a little bit more accurate panoramic view. So the first thing that I would do in this case is like, I already know, okay, I want to put in a couple implants. Let's say I'm just doing 2 implants here. I'm going to set up, get out of the model editing module, and go into my surgical guide advanced module. And now I get the implant view. And I kind of already, since I've been through this case, I kind of know right where I want them. I'm going to select mandibular. The only difference here is it flips your implant up and down. So if you forgot and you left maxilla, you just got to spin your implant. But we want it to be this way. We're putting in the mandible. And I already know that these are going to be 2 smaller implants to start with. I'm going to do, I think it's just 3 5/10s, because this is a really, really thin ridge, as you'll see. And let's just put one here. So here's your views. Up here, you have your cross section that's looking at it from the side. Up here, you've got your axial, so looking at it straight down. Up here, you've got your rotational. So as I rotate my mouse, my scroll wheel, I can look in 360 degrees and just keep spinning around the implant. Am I all in bone? So let's just say we're good, we're happy, we like this little implant at this position. All you have to do is right-click it and then duplicate it. And then there's another one sitting there, and just drag it over. And now we've got another one. Let's just say we spin it around, and we like the position. We're happy with it. Let's just say we're good to go here. We won't spend a lot of times with like the Y behind it. But you do need to think, like, look at this little knife edge ridge. As you flap this open, you're going to have to bevel that down. Right? Somehow that's going to have to get smoothed down, because remember we talked about entering into that area with a drill. It's just going to fly off that. So let's just say we're happy with our implant positions for this case. As we look over in our implant list, we want to do 2 things. We want to change our drill kit to our fully guided kit. Remember we said it doesn't default to fully guided. We always got to switch it over. And then over here is our list of implants. We've got our implant bodies that we can show and hide. Here we have our abutments. We're not putting abutments in for this case. And then here's these guide tubes. So we put these guide tubes on. Let's look at what these do here. So these guide tubes are what we talked about being the actual part that gets incorporated in the guide. Well, look at where this guide tube is you can see the outline. This yellow is the guide tube. Here's the denture. So we want to get these up. So let's just say I wanted to print this guide. And remember I said I like to bump up my offset by 3? So here's my default offset. If I bump this up by 3, we're going to change this to 11. So as soon as I hit 11, now the guide tube went up. Now it's inside of my denture, so it's away from the bone more. This is just an easier way to get that guide tube up. And then I can see how it just did that one implant here. I can hit apply to all, and it raised the other one up. So now I got both my guide tubes in here. Now, this guide tube is defaulting to a metal sleeve, like you're going to put a metal sleeve in it. So let's just assume we're going to use a metal sleeve here. What I'm going to do is now, in really simple fashion, I'm going to just convert this into a guide. So we're going to go to our guide panel. And the very top option is Create Scan Appliance Guide. So this, what that button does is it says, oh, you have a scan appliance. Just turn it into a guide. So it's just going to incorporate those 2 guide tubes that we positioned and make this into a guide. So we're on the mandible. We want to use it on our STL lower denture. We don't need to mess with any of this. And then we hit Create Scan Appliance Guide. So in one simple click, we put 2 implants in, and it's just going to make us a new STL, a copy of our denture, but it's going to house 2 guide tubes in it to actually drill through and make a guide. Okay, now right off the bat you see, okay, where is it? What did it do? Why is it like fuzzy like this? The reason is because now we have a new surface. We have our original lower denture surface and then our new scan appliance guide. And they're both checked visible. So if I uncheck the lower denture, there's our guide. I'm also going to turn off the CT because it's just a lot of noise. And then now you get to view, okay, now I see this yellow mesh here. That's the guide tubes. So now we can go back and hide our guide tubes. And that's why I said turn your guide tubes off to look at what your guide actually looks like. And now I'm looking at this and I'm like, all right, this looks pretty good. It looks like an exact representation of her denture that was scanned, and now there is guide tubes built into it, and I can pop 2 metal sleeves in here and ready to go. So with one click, Blue Sky will convert a denture into a surgical guide scan appliance, a scan appliance guide, excuse me. Cool. All right, so this would be ready to export, and you'd be ready to go and go plan the surgery.